Bakit? Teka lang. Wait lang. Si Popmaster lumalabas sa stream but wala siya sa mismong chat. Wait, I think I know why. Bakit? Ayun pala. Spammer ka kasi, Popmaster. YouTube emotes. Yes, I have emotes already. Anyway, good afternoon, everybody. I have emotes. I actually added more. So if you're a member, you have access to the emotes. I'm supposed to have, I think there's supposed to be like 9 emotes or something. I added like a little more. Yeah. So, hello. Ay, tanggalin ko muna to. Since sa YouTube tayo, I don't know this. Okay. Hello and good afternoon, supporters. Today, it is medical education. Medical education for charity. Hello. So, we are still around $50, $250 away from hitting halfway goal. So yes, please continue to share and tell your friends about this donathon. Continue. Di ako nakasali ng community games. Yeah, I'm supposed to edit some clips. I have some clips of those. I'm supposed to edit some clips. My other editor is busy. So yeah. Tell to the oil bungle, yeah. We'll see. We still have until December 16th. We still have a lot of time. So, yeah. Anyway, good afternoon, guys. So, this medical education stream is about major traumatic injuries. 3 years ago, I already made a stream about trauma, and it's similar, or almost the same. Hey! Excuse me. Yeah, I made a stream about trauma like 3 years ago. So, that's basically what this one is about, except I made some changes. I've updated it because, my PowerPoint last time lacked some important stuff. Especially on how we assess trauma patients. So, this is more updated. And I think, if I remember last time in 2022, when I did this medical education stream about trauma, we had a different patient back then as a sample. This time we have 2 patients as samples. We have 2 unwilling volunteers to be our patients in this PowerPoint presentation. But anyway, so I'm gonna do this my major traumatic injuries, because like I said it 3 years ago also before. When talking about major trauma, it's better presented as a case rather than just lecturing it like per system. This is better managed as cases. Like, if a patient comes in presenting with these things, these injuries, what are you gonna do? Because that's how trauma is. It's very fast-paced. You get a patient, you have to assess them right away and make decisions right away. So it's just like that. Duality. Sino kaya? Forced volunteer. More like unwilling volunteers, but they, wala. Alright, let's jump in. Teka. wala dito. Oh, wala yung music ko. My music disappeared. There we go. Okay. Major traumatic injuries. Because I think I discussed minor traumatic injuries before. So, minor traumatic injuries before in my other medical education stream. We talked about like lacerations, abrasions, avulsed wounds, and all that. So, this time, we're gonna talk about major traumatic injuries. So, mostly, injuries to the chest, to the abdomen, to the head. Those are the most common. We're gonna talk about more common ones, okay? Most common. I'm not gonna talk about, like, wild-ass injuries, like, you know, people that get stabbed in the eyes, or, like, people who get stabbed in, wherever they're at in their butt. Okay, we're gonna talk about the common ones, okay? Okay, so major traumatic injuries. We're gonna do this as a case, okay? So first we'll talk about chest trauma. It's gonna be the same flow as that's like 3 years ago. Chest, abdomen, and head trauma. Okay. So chest trauma. All right. So we have JTR. Okay, this JTR. I had to cover the face for anonymity. He has to be an anonymous patient. So we have JTR, who came to the ER, who came to our emergency room. Okay, nature of the incident was a stab wound, okay? He got stabbed. So, at 12 midnight, last night, November 12, kagabi lang to. 12 midnight, bigla siyang sinaksak. Okay, sa barangay Supot, South Elysium. Okay? And he came to the ER with his vital signs: BP of 70/40, heart rate of 130 beats per minute, respiratory rate of 30 cycles per minute, temperatures within normal 36.6, and O2 sats is 84. Okay, so BP. Blood pressure is, normal blood pressure is, around 100 to 120 over 80 to 90. Okay. Heart rate, normal heart rate is usually 60 to 100. Respiratory rate, normal cycles are like 15 to 20. Temperature normal is around up to 37.5 or 37.6. Fever is 37.8. Okay. Tapos O2 sat, oxygen saturation. Okay, normal is 95 to 100. So you can see that this poor patient of ours, JTR, is hypotensive, okay? And you know he's unstable. He has his BP is very low. His BP is very low, 70/40. Heart rate is high, 130 beats per minute. Tapos respiratory rate, parang nahihirapan siyang huminga. Okay? So, close up, okay? Oh my god, ay, hindi ba siya naputol pala dito. Anyway, so when we assess trauma patients, we follow what we call the ABCDs of trauma. So A for airway, B for breathing, C for circulatory, D for disability, and E for exposure. This is what we call the primary survey. So when we speak to him, he speaks in phrases. He has no airway noises. Okay, when you see him, he's speaking to you, but in phrases, parang hinihingal, difficulty breathing. and shortness of breath. He's tachypnic. Tachypnic means he's breathing very fast. And then we auscultate him. He has decreased breath sounds on the left side. Okay. And then circulatory. So he's slightly pale. Unfortunately, we can't see the pallor because we have to, we have to make sure, we have to cover the identity of the patient, okay? He is hypotensive. He's tachycardic. Tachycardic means heart rate is very fast, but there's no abnormal heart sounds, okay? Okay, so disability, so meaning more on like neurologic. So he's GCS 15, meaning he's conscious and coherent. He can follow instructions. So he's talking to you, he's answering your questions. Exposure, so more on like after we expose his body, we look for the injuries. So kunwari na lang na hinubaran natin siya, okay? Unfortunately, I couldn't secure a picture of him naked. Or well, the patient didn't want to show himself naked, so just imagine him naked. He has a 2-centimeter stab wound on the 4th intercostal space, left anterior axillary line. So when we say 4th intercostal space, when you say intercostal space, that is the space between the ribs. So if you feel your chest, you can feel your ribs, right? If you feel your chest, you can feel your ribs. The space between your ribs is called the intercostal space. Alright? So his stab wound is on the level of the 4th space, intercostal space. And when we say AAL, which means anterior axillary line, axilla is your armpit or your kilikili nyo. Okay, so that's around here on this level. Here. Kunwari ito yung anterior axillary means the front of the kilikili. Okay, so here. Okay. And then when you palpate his abdomen, it's soft and non-tender on examination. Okay? So, that's his So, given this patient, what are you going to do? Kunwari kayo yung doctor. Imagine you are the doctors of this poor patient, JTR, who got stabbed in the chest. What are you guys going to do? Oral recitation. Wait, I need to wear my glasses. There we go. Pray for you. Oi! Call 911. No, you guys are the, let's say you supporters are the ones on duty in the ER. So he goes to you. What are you guys going to do? Supo ka rin po sasagot. Funeral service. Buhay pa siya. You have a chance to save this patient. You have a chance to save this patient, guys. So as his attending physicians, what are you guys going to do? Sampalin for response. GCS 15 na nga siya. Sampalin for... He's already responsive, man. He's conscious and coherent. You can talk to him. He's awake. He is awake. Okay. Don't pull out the stabbed object. The knife isn't there anymore. You just have a 2 cm stab wound. There's no knife stuck to him. I just put an image there that he got stabbed, but there is no knife anymore. Rekta ER, kayo nga yung nasa ER eh. Kayo nga yung mag-manage sa kanya. You guys are the ones he saw first. Unfortunately, there are no other hospitals for him to go to, so Supoter Medical Center was the only hospital he could go to, and you guys are the frontliners. What are you gonna do? What are you gonna do to poor JTR? Stop the bleeding. Okay, what else? I used to yell, but put pressure on the wound and cloth in the meantime. Okay, what else? Grinipuhan, x-ray agad. Stitches, tumawag kay Doc Shiori kahit out of duty. Wala, nasa Boracay ako. nasa Boracay ako, di nyo mo di ako makakapunta. Nasa Boracay ako. Sanitize the wound. Okay. Alright, okay. I think only, okay, fine. Bigyan ng epi. Diyos ko, ang gising na nga yung pasyente. Bibigyan niya ng epi. Okay, fine. Okay. Alright. One of the supporters suggested a chest x-ray. Okay, you got a chest x-ray. So, kunwari, ito yung chest x-ray niya. Okay, you had a chest x-ray. Kunwari, ito yung chest x-ray niya. What do you guys notice in this chest x-ray? What do you guys notice? I remember I talked about this in one of my other streams, my older streams. I'm pretty sure I did. What do you notice? Just tell me. What do you see? What do you see, chat? What do you see? Sino nga na siya? May damage yung right lung. Ano pa? What do you guys see? And I'll tell you what I'll tell you. Internal bleeding, right lung anomaly. Guys, this is the right and this is the left, okay? Right, left. Kunwari, this patient is facing you. JTR stab wound is on the left, okay? So, this is right, this is left. Ano? Right lung anomaly, pneumothorax. Nasa left yung stab wound, mali yung x-ray. It's left! Because it's facing you. So, don't get confused. This is the right side, this is the left side. He got stabbed on the left. It's facing you. So, the x-ray is facing you also. This is the right, this is the left. Sisihin yung radiology. Dok, dyslexic ako. Walang kinalaman ng dyslexia. Alright. Okay. Alright, fine, chat. Diyos ko, Lord. Diyos ko kayo. Okay. One of you got it right, even though it was a guess. Si Pochacha got it right. It's pneumothorax. Okay. A lot of you guys said the right lung has damage, so this is the right lung. This is the left lung. The right lung is actually normal. This is normal. Okay? It is normal for your lung to have markings like these white markings over here. It is normal for the lung to have that. These white markings. It's abnormal for the lung, the chest to be this clear though. Okay, so he has pneumothorax, which is air in the chest that is not supposed to be there. Okay, so this is it. That's why you don't see the lung markings. It's because this is the lung already. Ito, you see this? This is his lung. This right here. That's his lung. It collapsed. His lung collapsed because of the air. Okay? The heart, weird yung heart. The heart is shifted to the right. So you can see the heart is kinda, ito yung heart niya. This is the heart. Right? The heart is shifted to the right. And then you see this tube right here. This is the airway or the trachea. And it's also shifting to the right. The reason why it's shifting to the right is because there's so much air over here. Okay. Alright, so Given that he has pneumothorax. I'm using my mouse to draw. He has pneumothorax on the left. So his diagnosis is pneumothorax left secondary to stab wound. Stab wound. Okay. I don't get it. Collapse yung left lung pero may naipon. Yeah. The left lung is collapsed because of the air. The air is pushing the lung inward. The pressure is too high. So the lung collapses. And that's why everything here is moving towards the right side. The lung is an organ. And the air is supposed to go through the airways and into through the lungs. But the air is not supposed to be outside the lungs. Okay. Nasa labas ng bagay yung hangin. Yes, it's inside the pleura but not in the lungs. This is a pleura. Okay. So what do we do to this patient? What are we gonna do to JTR that now that we know he has pneumothorax? To be specific, it's tension pneumothorax actually. This is the specific pneumothorax is tension pneumothorax. What are we gonna do? Ballpen sa dibdib. Ballpen sa dibdib. Grabe naman, ballpen. You're in a we are in support. You are in supporter medical center. You have assume you have all the medical equipment. Hindi naman kailangan ballpen. Malit na puti yung lung. Yes, Fat Master, this is the lung. This is the heart. It got pushed to the right. Flex tip. Okay na ako, chat. Okay. Alright, this is the management. Okay, we're going to do a closed tube thoracostomy or a CTT. This is shortcut is CTT. CTT on the left. Okay, so we're basically gonna put a tube through his chest. Okay, and this is how it is done. I've done so many of these. So what you do is lalagyan ng anesthesia over here. Gonna put anesthesia. Okay. And then hihiwa ka sa you're gonna make a cut on the 5th intercostal space of the anterior axillary line, so a little below the stab wound. And then pierce through the pleura using an instrument, okay? And then penetrate his chest with your finger, and then put the tube in. Okay, you put the tube inside. Dok, wala na daw po tayo anesthesia. This has to be done with anesthesia, okay? Local anesthesia. Yeah, so this is done locally. So, this is done very quickly in the ER setting. This is not done in the operating room, okay? Putting a chest tube. Putting a tube. You do it in the ER. If a patient is presenting to you with a stab wound and having a hard time breathing, and then you have an X-ray saying he has pneumothorax, you have to put a tube immediately. It is an emergency. Immediately. Okay. So you put the tube, and when you successfully put the tube, the air will come out. You're gonna connect the tube to a bottle over here. And then, it will start bubbling if he has air. But if he has blood there, the blood will come out. So, you manhandle the baby. Ba't ang ano nyo? Kinakawawa nyo naman si JTR naman. Nasaksak na nga eh. Anyway, the management of this is for both pneumothorax and hemothorax. So, air in the chest and the blood in the chest also. Okay? So, usually you get those when there is a chest injury. So, it can be a blunt chest injury or a ano tawag dito, a penetrating injury. Okay. Okay lang yan, Doc. Regular patient natin. Alright! Diyos ka! Kawawa naman. Here, I will show you. So, once you put the tube inside, what's gonna happen is the lung will re-expand. So, remember the chest x-ray a while ago? You see the lung was collapsed? When you put the tube inside, and once the air goes out, the lung will re-expand. Okay? The lung will re-expand. And that's what's normal. Okay, kanina yung chest x-ray, it collapsed yung lung. Once you put the tube in and all the air comes out through the tube, the lung will expand. Okay? Alright? Okay kayo, guys? Do you guys understand? So, putting a chest tube applies to both pneumothorax and hemothorax. So, air in the chest and blood in the chest. Okay. So, congratulations, chat. You saved JTR. Tapos, pinauwi niyo siya. After a while, so he was admitted for a few days. Tapos, naubos na yung hangin, lumabas, and then you remove the tube. Tapos, pinauwi niyo na siya. Pinauwi niya na si JTR. He went home without any problems. Okay? 100 kasi. May PF. Ang laki naman ng PF nyo. Ang laki ng PF nyo. Tapos ballpen ang gagamitin nyo para saksakan. Pinauwi agad, di pa nagbabayad. Huwag kayong mag-alala kasi few hours later, siguro mga bandang hapon, bumalik si JTR. Okay? Pumunta siya sa barangay Potsu. Tapos, ang nangyari, binugbog siya. Okay? So, si JTR has come back to Supporter Medical Center ER as a case of mauling. So, binugbog siya. And if you ask him, sabi niya, hindi niya kilala yung mga nambugbog sa kanya. Basta nabugbog siya at around 5:30 p.m. Okay? So, that's around 17 hours after siya sinaksak. 17 hours after siya sinaksak. Pumunta siya sa barangay Potsu sa South Elysium. Okay? Binugbog siya. Vital signs niya. 90/60. So, a little low. Heart rate is 99. Respiratory rate is 20. Tapos, temperature niya 36.5. O2 status normal. Okay, so, his vital signs are okay lang. Baka niya, sino bubugbog? Sino nagabugbog sa kanya? Wala, nakatakas yung bumugbog sa kanya. Alright, so, these are his vital signs. So, you're going to examine him now. So, here we go. Airway. ABCs of trauma. Airway. He speaks in sentences, okay? No airway noises. He doesn't have any difficulty breathing at this time. No shortness of breath. He's slightly hypotensive, no abnormal heart sounds. GCS 15, conscious coherent. So he's awake, he's conscious coherent. And then when you look at his you expose his body and you look for the injuries. He has multiple bruises on the right and left chest with slight tenderness on palpation of the epigastric area of the abdomen. So epigastric area is around here, the upper part of your abdomen, the upper middle part of the abdomen below your ribs. below the sternum or below your chest. That is the epigastric area. So it's slightly tender when you press it. Otherwise, he has a lot of bruises on his chest. Okay? Hindi na, I wasn't specific anymore. Basta in general, marami siyang bugbog. Yan o, yung mga purple, yan yung mga bugbog niya. Kunwari, yan yung mga bruise niya. Okay? Oh, thank you for the super chat, Pochacha. Nag-i-irnarte lang yan doon pauwi na. Nag-i-irnarte na. Nakita mo nga may may mga pasa-pasa siya dito sa dibdib. May pasa-pasa naman siya. Hindi naman nag-i-irnarte. So, chat, what are you going to do, chat? What is your plan, chat? Ano? Karwari, bumalik siya sa inyo sa Supporter Medical Center. Bumalik siya, oh. And then, kayo ulit, nakita nyo si JTR. Anong gagawin nyo? What are you guys going to do? So basically, this is a blunt chest trauma. Nagpasaksak at nagpabugbog lang yan para makita si Doc, kaso nasa Boracay. Pauwi na lang. Malayo sa bituka, pauwi. Ba yan? Diyos ko! Siyempre, i-manage nyo na muna. Huwag lang pauwiin. I-manage nyo naman. Antayin na lang si Doc mga 1 week after. Okay, fine. Oh. Kung ako yan, o kunwari, tumawag kayo sa akin. Tumawag kayo sa akin sa, ano bang ang ginagamit ng mga Dr. Viber. Tumawag kayo sa akin sa Viber. Yan ang ginagamit ng mga Dr. Viber. Sa Viber, tinawagan niyo ako. Tumawag kayo sa akin. Doc Shiori, si JTR, ang kulit, nandito ulit, nabugbog sa Barangay Potso. Tapos ako, I'm your attending doctor. Tapos sasabihin ko sa inyo, sige, request kayo ng, lagyan nyo ng, resuscitate nyo, lagyan nyo ng fluids. Tapos, since nabugbog sa chest, injuries lang na sa chest, chest x-ray ulit natin. Let's have a chest x-ray done. And since he has, slight tenderness in the abdomen, we'll do an ultrasound. Check kung may internal damage. Yes. So, stabilize him. Okay? IV fluids. Give him fluids. Alam mo na dehydrated na pala yan. Di pala siya kumakain. Di pala siya umiinom. He hasn't drank anything. Hasn't eaten anything. So, give him IV fluids. Diagnostics. Request for chest x-ray and a FAST or an ultrasound. Fast ultrasound. Fast ultrasound is called Focus Assessment and Sonography for Trauma. Okay? So, this ultrasound, a FAST, I will explain it later, but we use this a lot in trauma patients. Okay? So, chest x-ray. So, you requested for a chest x-ray, tapos ito yung nakita nyo. Ito yung nakita nyo. Ha? Okay. Ito nakita nyo. Medyo... I just realized something. I should have used the... Ayan! May tubo yung chest x-ray. Sa chest x-ray, may tube pala siya. I just got this image from Google, okay? Random image from Google. Hindi ko masyadong tinignan na mabuti kasi apparently may tube pala to. Wait, this is a tube actually. This is how a tube looks like in x-ray. Tapos may boobs pa siya. May boobs! May babae pala yung x-ray. May boobs yung x-ray. Anyway, labo naman yan. Sa baga lang sinuntok scripted talaga. Okay, anyway. I'll just go through this. Kasi medyo pangit yung pinili kong chest x-ray pala. So, this x-ray, he has a tube here. So you did a chest x-ray and then you saw that there's a portion here that's white. And, oh, thank you for the dono potata! Thank you so much! Thank you! The surgical patients will really appreciate this, your dono. Thank you, thank you! We forgot to remove the tube from last time. Anyway, ayun, basta, you noticed that when you looked at this chest x-ray, I'll just tell you what I see, okay? So, when you look at this chest x-ray, he has a rib fracture on the, what's this, sixth rib. He has a fracture on the 6th and 7th ribs, okay? He has a fracture on the 6th, 7th, and 8th ribs. Okay? 6th, 7th, and 8th rib. And then there's also a portion of the lungs that's been white out on the area of the fracture. Okay? Sinong attending surgeon nun? Ba't di tinanggal? Kayo yun! Ay, wait. Parang may fracture din sa 5. I think there's a fracture here on the 5th rib. Parang may fracture din sa 5th rib. So, 5, 6, 7, 8. He has a fracture on the 5th, 6th, 7th, and 8th ribs. On the left. Yeah, I'm looking at it. Tinitingnan ko eh. Okay, and then there's a white shadow on the left lung. Okay? Tapos, after you did a chest x-ray, you did a fast. Okay, you did an ultrasound. I will explain to you guys what a fast is or what a fast ultrasound is. Okay, so fast ultrasound. Okay, medyo ano to. This is a little small, but I'll explain it. So you did an ultrasound. When you have a trauma patient, a lot of doctors in the ER, they will do a fast. A focus assessment with sonography for trauma, and they will scan 4 parts of the abdomen. Okay, so one is by the chest. Second is on the right side, on the right upper side, and then the third is on the left upper side, and then the fourth is on the lower abdomen, where your bladder is. Okay? The purpose of this fast or the ultrasound is to check if there's fluid fluid in the abdomen and in the heart. That's right, there's one. The number 1 is to check for the heart. Okay, to check if there's fluid where they're not supposed to be. So 1 is to check the heart. So it's called the pericardial view. So you're gonna examine the heart, you're gonna examine the pericardial space. Okay, to check for pericardial effusion or cardiac tamponade. Number 2 is to check the hepatorenal space or the right upper quadrant. You're gonna check the space between the liver and the kidney. And if there's a space there, that means there's fluid, meaning that there's bleeding going on inside the abdomen. Number 3 is the the perisplenic or the splenorenal space. So between the spleen and the left kidney. And if there's a space there, it means there's fluid, or bleeding. Okay? Lastly is the hypogastric or the suprapubic view, where you check the bladder. So if there's a space around the bladder, not within the bladder, okay? Because when you look at the bladder, there's gonna be like kung may ihi doon, if he still has some urine in there, you're gonna see like a round black area. But if outside the area, if there's a space, a black space, then that means he has either a leak or there's bleeding. Okay? So that's the purpose of the fast. It is called fast. It is also called fast because technically this is done within a few minutes. Like at bedside in the ER, we grab a bedside ultrasound, scan the abdomen and scan the heart, and if there is, it's either your result is either positive or negative. Okay, so if there's fluid anywhere, it's fast positive. If there's no fluid, then it's fast negative. Okay? So every surgeon needs to know how to do this. And there's even an algorithm. So if you have a stable patient, like the vital signs are stable, he's talking, he's fine, but you're fast positive, then you can do a CT scan to explore where the injury is inside. Maybe it's a stable injury, but you gotta identify where the injury is. But if the patient is unstable and you have a fast positive, he's unstable, meaning like he's hypotensive, tachycardic, he's unstable, then that's an immediate surgery. Okay? Immediate surgery. But if he's unstable but fast negative, then you can do a CT scan. Alright, you guys understand? Gets ba? Naintindihan nyo na? You understand siya? Or did I just, overflow your brains? Okay, it's pretty simple actually. So, alright, so for JTR's case, so I said that his chest x-ray had a white area here, white shadow. It's called a pulmonary contusion. So this is usually caused by rib fractures, blunt trauma to the chest and a fracture of the ribs. So the rib fracture can cause a pulmonary contusion, and this thing doesn't need surgery actually. You don't need to do surgery. You just need to observe. It's conservative management. All you gotta do is just hook him to oxygen and then observe. Sometimes pulmonary contusions can evolve into hemothorax, so if he starts having fluid again in the lungs or in the chest, then you have to put a tube. Okay? Now he is pretty much stable. Where is it? Kinda stable. Let's say you gave him IV fluids and his BP went up to 120/80. Heart rate went down to like 89. He is stable, so you can observe him, or you can request for he is fast negative, so there's no noticeable injury in the abdomen. So if he's stable, you can just observe him, and if he's improves, you can send him home. Okay? Or if he still has abdominal pain, even though it's stable, you can request for a CT scan. Okay? And depending on the CT scan, whatever you find, if there's an injury in there, it can either be surgical or non-surgical. It really depends. But usually in a stable patient with a stable injury, you don't need to do surgery. Alright? So, in this case, mukhang safe naman tong si JTR. Okay? So, at least nagawa din yung gusto nyo pauwiin. You guys wanted to send him home, so you sent him home. Okay? Alright, do you guys understand, chat? Do you understand? Because, after this, we're going to abdominal trauma. You guys understand? Okay? Alright. Because we got another patient. I hope you guys got it. Pinalayas agad eh. Kayo eh. Gusto nyo eh. Gusto nyo palayasin eh. You're... Okay. So, next patient. We have a new patient, okay? So, we have a patient for abdominal trauma. So, we got OO. Okay? Si OO. Yun lang sabihin ko. His name is OO. Starts with an O and ends with an O. So, nature of the incident. So, nagda-drive siya. Vehicle. He was driving at 1 a.m. Tapos, nabangga siya. Okay, he was driving at 1 a.m. This morning, early morning in Barangay Naputol, South Elysium. Okay? He got hit by a motor, but he accidentally hit a poste. Yan. May poste dun sa Barangay Naputol, o malaking poste na nabangga niya. He hit si JTR yung nabangga. So, vital signs. 90/60, heart rate 100, RR is 21, temperature 36.5, autosat 97. Okay? So, this is patient 00. Anonymous pa rin si O. Okay? Sige. Tapos, alright. In-examine nyo si OO. Okay? So, airway. He speaks in sentences with no airway noises, no difficulty breathing, no shortness of breath. He is slightly hypotensive. He is tachycardic with slightly tachycardic kasi 100, but no abnormal heart sounds. He is awake, conscious, and coherent. So GCS 15, meaning he is you can talk to him properly. And then hinubaran niya siya, and then on physical examination, you noticed a 5 cm by 6 cm hematoma on the left upper quadrant of his abdomen. So on the left upper part of his abdomen, with slight tenderness on palpation on that area. But on the other quadrants of the abdomen, it is soft. So the only tender part is the left upper part of his abdomen, or the left upper quadrant. Alright, so, given those, what are you going to do, chat? So his only complaint, after niya binangga yung poste, or what he believed to be yung poste, his only complaint is that his the left upper part of his abdomen is hurting, where the bruise is. What are you guys going to do, chat? Anong gagawin niyo kay patient O? Chat. Cold compress. Ano pa? What else? Pwede naman, but what else? Fast. Okay. Very good si My Shark. Very good si My Shark. Okay, yeah, you're gonna do a fast, okay? So you're going to stabilize him, resuscitate if he needs to be resuscitated. And one of the first things you're gonna do is a fast. Okay, so, but what if na-fast mo siya, tapos fast. You can also do, if the patient is stable, after you gave him IV fluids, he stabilized. BP went up a little, heart rate went down. Fast is, let's say it's negative. If the fast is negative, you don't need to do anything. But if the fast is positive, but he's stable, you can request for a whole abdominal CT scan. Okay? But otherwise, let's say for OO, he is fast negative. Okay? He's fast negative, so we can just observe the patient. And then you want pauwiin. Okay, pwede nyo pauwiin. O, pinauwi nyo agad. O, diba? Si OO, safe si OO. Okay? Now, kunwari fast positive siya, and then you did a whole abdominal CT scan. Or, let's say fast negative siya. Okay? And you observe the patient. So, when you observe the patient, meaning you do a physical examination on him every now and then. So, you notice, let's say you're palpating O's abdomen. And, he used to complain that the pain was on the left upper quadrant. But now he's saying the pain is now on the right lower quadrant of the abdomen. Okay? Now he's saying there's pain on the right lower quadrant. So if the pain transfers somewhere else, that is a sign that you have to reassess. Because why is the other part of the abdomen painful, right? So you can reassess by doing another fast, okay? and let's say you did fast and then it was positive, you can do a CT scan. And then your CT scan can tell you if there is an injury or not. And if his vital signs deteriorate, then that means you have to do immediate surgery. Okay? Especially if the symptoms worsen. So he becomes unstable and then there's positive findings on CT scan or fast. Immediate exploratory laparotomy. Okay? Sabay appendicitis. Okay, exploratory laparotomy. So when it comes to trauma and when you do an exploratory laparotomy on a trauma patient, one of the first things you have to address is bleeding. Bleeding is the #1 priority. Look for the bleeding, control the bleeding, then you address any spillage. So that's the #1 concern is always bleeding. So usually if the injury is on the left upper part of the abdomen here, the usual injury here is the spleen. So depending on how bad the injury is, you can if it's not bleeding, you can leave it alone. But if it's bleeding, then you can suture it. But if it's like a shattered spleen or like a really, really injured, like a really wasak yung spleen niya, then you have to remove the spleen. Okay? Nagpop yung abdominal aorta, very rare for it to like get injured because the abdominal aorta is all the way at the back. It's at the back, so before the abdominal aorta can get injured, you're gonna have injuries first on your like liver, your stomach, your intestines before it even reaches the aorta. So yeah, you're gonna do a splenectomy if the spleen is shattered or if the spleen is really bad. Okay? But otherwise, there's some injuries to internal organs where the bleeding is stable and you don't really need to do it. You don't want to like do anything to it. You can just leave it or like suture the injury, and it's okay. You can just leave it. Okay. So sometimes there are injuries where when it comes to blunt abdominal trauma, most of the organs that are like injured, there can be the liver is one organ that's injured a lot because it's pretty big, and it's usually on the right because this is where the larger lobe of the liver is. You can have a blunt injury to the abdomen where the intestines get perforated. Okay, so yeah, but always you have to address any bleeding first before spillage. So let's say pinauwi niya na si O, okay? Tapos next. So next case, okay? We're gonna go to this is blunt. The next case is a penetrating abdominal injury, okay? But do you guys understand so far? So far, you guys good? He wasn't using it. Okay, chat. Yeah. Alright. Okay, next case. Alright, next case. JTR, bumalik siya. Gunshot wound. 12 PM daw, 12 PM siya na baril. Sa Twitch daw kasi na baril kasi nag-type siya ng exclamation point tuli sa Twitch chat ni sa Twitch chat, tapos ang sabi dito, tinuli ng supporter si JTR gamit shotgun. Congrats JTR, the operation was successful. Your PP went shorter by 909. Okay. So, shotgun ang nagamit pang baril. Binaril sa Twitch chat. Okay? Kasi ano eh, nagpatuli daw siya sa Twitch chat. Nung tinype niya yung exclamation point tuli, ayan, supporter daw. Nagtuli sa kanya gamit shotgun. So, successful daw yung operation at the PP went shorter by 999%. Anyway, so vital signs. So, ito, si JTR bumalik dito sa supporter medical center. O, vital signs 80/60, heart rate 115, respiratory rate 21, temperature 36.5, O2 sat 96%. Okay. So, yung airway niya. So, we're gonna do the ABC. So, airway. Screams in sentences. So, sumisigaw siya. So, sumisigaw siya! No airway noises. Malabag kasi sumisigaw siya. So, his airway seems to be fine because he's already screaming. Okay? Tapos, breathing. No difficulty breathing down. No shortness of breath. Circulatory, he is hypotensive, tachycardic with 115 beats per minute, no abnormal heart sounds. He is awake and coherent, GCS 15, but he's just screaming at you. Okay. And then you, hinubaran niya siya. Tinignan niya yung mga injuries. You looked at his injuries, okay? So you have multiple 1.5 cm gunshot wounds here on the point of entry. Okay, multiple 1.5 cm gunshot wounds where the point of entries are as follows. There's 4 on the hypogastric area, so this is the abdomen. Okay, hypogastric area of the abdomen, and there's 4 on the okay. And there is no point of exit for the wounds. Okay, so that means when we report gunshot wounds, we always have this thing called point. You have to indicate the point of entry and the point of exit. And when we have gunshot injuries in the ER, we have to know the trail of the gunshot if there is a entry point and an exit point. So in JTR's case, there is no exit point. That means lahat ng bala nandun pa rin. Okay, lahat ng bala nandun pa rin. Kasi shotgun nandun pa rin. Okay? So, chat. Given this case, anong gagawin nyo? Chat, supporters, what are you gonna do? This is an emergency case. Gunshot to the lower part of his body. And, point of entries. There's 8 point of entries of the bullets, but no point of exit. No points of exit. Okay? And then, he is hypotensive, tachycardic. What are you going to do? Chat, anong gagawin niyo kay JPR? Bigyan ng mixed herbs. What mixed herbs? Resident Evil. Circumcision, wala na nga, non-existent na, circumcision, natanggal na nga, tinuli lang isang supporter sa Twitch, X-ray para makita saan naiwan sa loob. Okay. Is it a good or bad thing that there's no exit point? It just means that the bullets are still inside. And it depends. When it comes to bullets, it really depends whether it's a good or bad thing if there is no exit point. Because if there is an exit point, it means it could have cut through something. Whereas if there is no exit point, it means that maybe it might have stayed inside but didn't hit a vital organ. Direto sa St. Peter, wala na yan. IV fluids create point of exit. Gago. Ano? Okay, let's go. Chat. Alright. Resuscitate the patient. Stabilize him. IV fluids. Very important. And then, someone said X-ray. To check para makita. Yeah, you can do an X-ray. Pelvic X-ray. Consider the location of the, Consider the location of the injury. So he was shot at the lower part of his body, and that's where the pelvis is. So you have to do a pelvic X-ray. Because what if there's a pelvic fracture? And doing a pelvic X-ray can also help you identify where the bullets are, because it will show up on the X-ray. Okay. And then, considering that this is a penetrating injury, okay, penetrating injury, you have to prepare the patient for a stat surgery. So you can insert an NGT, Foley catheter, IV antibiotics. Start him on IV antibiotics. Stat exploratory laparoscopy. Okay. Kawawa naman, hindi nakakain dahil di maka-move on sa pipi. Alright, so okay. Let's talk a little more on okay, let's say you're doing let's say you're operating on him, okay? Naoperahan mo siya, stat exploratory laparotomy. So, what injuries do you suspect in a gunshot wound on the lower abdomen? So he has 4 here and then 4 on the lower abdomen. What organs do you think are damaged in the lower abdomen? Because I'm pretty sure you guys know what possible organs are injured here. But what about the lower abdomen? Ano, chat? What do you think, chat? Bladder, perforated intestines, bladder and colon, gonaditis. Yeah, okay, yeah, bladder, especially bladder, okay, bladder. So, possible injuries here are the urinary bladder, the colon, yeah, or the rectum. It can also be the small intestines because they can also be there. So yeah. Alright, those are the possible injuries. And if you do an operation on the abdomen, so you're gonna look at the area of injury. So if there's any bleeding there, you have to address the bleeding first. Stop the bleeds first always. And then if there's any perforation in the bladder or in the intestines, then you address those next. So let's say he has one he has a perforation in the bladder. Tapos nandun yung isang bala sa loob ng bladder, diba? So let's say he has a perforation in the bladder, tapos nandun yung isang bullet. So you can take out the bullet and then repair the bladder. Okay. If he has a perforation through the intestines, you just repair the perforations, depending on how big they are. Because if the perforation is small enough, you can just suture it. But if it's big, if it's a big perforation, or if it's like multiple holes in one segment, like let's say, let's draw an intestine. Like this is an intestine. Okay. If you have a hole like this, say that's a perforation, you can just suture this. Okay? Now if it's like let's say it's a through and through hole. You have a hole here. You have a hole like that, and then a hole here. So, back to back. You cannot just repair this, especially if it's this big. Let's say it's like that big. It'll be better to resect, or basically, you know, cut the intestine and then put them together. Remove the part of the intestine. So if you have an intestine that's let's say you have an intestine here that has multiple perforations in very close to each other, like that. Instead of repairing all of them, sometimes it's better to just resect. Okay? Or if it's a large injury, let's say it grazed through the side of the intestine and then just cuts through like that, then you have to resect that part. You can't just suture. As far as I know, or for I remember, as long as the injury does not cover more than 50% of the circumference, then you can just suture it. So if the injury is like that much, then like that, you have to resect it. Okay. Okay. And then if you see any bullets inside, you can extract them. Okay. And depending on the hospital, the bullets have to be surrendered as evidence. Okay, for medical legal. So lahat ng trauma, all traumas are always referred to medical legal or the medical legal team. Okay. Scrotum. So let's say after you addressed all the injuries in the abdomen. The next thing you're gonna do is address the injuries in the crotch. Okay. So fortunately for JTR, can I draw his here? So he has one injury on, let's say, kunwari ito yun, ha? I'm gonna draw it right now. yung dalawang bullet, pumunta dito. Kunwari dito. Shing! Ganyan. Tapos yung isa dito. Shing! It's basically missing the eggs, the testicles, okay? So, ang nabaril sa kanya, yung balat lang. O, di swerte niya. Safe pa yung itlog niya. Ang nabaril yung balat lang. So all you gotta do is just clean it and then suture it up, diba? Clean, debridement, suture, diba? Tapos yung dalawa yung dalawa bala, the two bullets are I don't want to draw it, man. Yung ay drawing. Basta the other two bullets are lodged in the skin, okay? It didn't go through. Okay, kanwari, sa sobrang basta. Nasa balat lang. Band-aid pwede na. Siyempre, tatahiin pa. Bigyan ng daon ng bayabas. Okay, so sinuwerte siya dun sa crotch. His crotch was lucky. Okay, so after that, edi yan, pinauwi niya na so after surgery, JTR recovered well after a few days, pinauwi niya na siya. Okay? Any questions, chat? Any questions? Before we go to head trauma? Scrambled eggs. Yeah, safe. His testicles were safe. Sinundo na ni O. Actually, yun nga eh. Sinundo nga ni O, actually. So, sinundo ni O. Pero habang sinusundo ni O, so, O came to pick up JTR. Pero kasi, ayan. Sinusundo na nga ni O. Pero at the same day, ayan, place of incident sa Supporter Medical Center, okay? So, habang sinusundo niya si JTR, apparently, someone at the rooftop of Supporter Medical Center, may hinagis na bato. May hinagis sa rooftop. Tapos natamaan siya sa ulo. Natamaan si O sa ulo. May pasaway na supporter dun sa rooftop ng Supporter Medical Center nang hagis ng kung ano-ano. Galit na galit yung supporter sa rooftop eh. So may hinagis siya. May hinagis siyang brick or something. Yung concrete, may hinagis siya tapos natamaan si O sa ulo. Hospital terrorist factor. So anyway, so may naghagis ng concrete na bato doon sa someone threw a concrete block on the rooftop and it landed on O's head. So O had like a loss of consciousness. He lost consciousness for a while, so loss of consciousness, but no vomiting, okay? He lost consciousness for a while. Ay. Si Poker yan kasi walang guide. So anyway, vital signs. After he lost consciousness, dilala siya sa ER, diba? With vital signs, 120/80, BP, heart rate is 92, respiratory rate is 20, so basically normal. Okay? Normal vital signs. So ayan, ito yung injury niya, ayan, purple. Ito yung sugat. Ito yung yung injury niya sa taas. So airway, speaks in sentences, no airway noises, breathing, no difficulty breathing. So, circulatory is normal. Okay, so here we have neurologic deficiencies. He is a GCS 12. So, the normal GCS or the Glasgow Coma Scale or the Glasgow Coma Score is 15. 15 is the highest. That is the normal one. And the lowest is GCS 3. Okay, so I've explained this before also. When it comes to GCS, the Glasgow Coma Score, 15 is the highest, and the lowest is 0. 3 pala, not 0. 3. The lowest is 3. And it's divided into EVM. So E means I, and then V is vocal, and then M is motor, or motor, okay? So, the normal is E4, V5, and M6. That is normal. This is equal to 15, okay? Now, his is 12, so he has E3, V4, M5, okay? So, what do you mean by that? When you say I, it means eye opening. So whether he has spontaneous eye opening or he only opens his eyes when you talk to him, only opens his eyes when you tap him on the shoulder or inflict pain or if there's no eye opening at all. So that's eye. And then vocal is when he when he speaks out. So the highest would be he is coherent when he talks. He's oriented. He knows. He answers you properly. And then the lower it gets, you can have like disorientation or confusion, or inappropriate words where he says random stuff that doesn't make sense, or when he starts just making sounds like mumbling or groaning sounds. And then lastly, the lowest is not saying anything at all, no sounds at all. Okay, for motor, so you have the highest is spontaneous or obeys commands. So if you tell him to, let's say, if you tell the patient to lift his hand up, he will lift it up. Tell him to grip something, he'll grip it. So that's an M6 or the highest. Now, if it's lower, the next is if you pinch the patient or tap the patient, he's going to localize the pain. So that he's going to point at the area or touch the area that you were inflicting pain on, or the area that you were touching. That would be an M5. An M4 is when he withdraws the pain. So if you pinch the hand, he's just gonna pull his hand away. Or if you pinch the foot, he's gonna pull the foot away. Something like that. And then there's also 3 and 2, wherein they either extend their extremities or flex their extremities. So like straighten up or stretch out their arms, or bend their elbows towards to themselves. And then M1 is no movement at all. Is GCS also used for concussion? GCS is used for any circumstance or any time there is a decrease in sensorium. As long as this patient is, let's say, is not responding, then you use GCS. It's part of the physical examination. A normal GCS is 15. So if the patient is like, you're talking to him, fine, not everything's normal, it's a GCS 15. But if you're talking to a patient that seems a little confused, then that's when you start thinking, what's the GCS of this patient? Okay? Magandang hapon, Doctor. Magandang hapon. Okay, so for O, he has a GCS 12, E3, B4, M5. So E3 meaning he opens eyes when you tap him or pinch him. V4, he is confused or disoriented, so he doesn't know what's going on. You talk to him and he's like really confused. M5 is he just points to the area where the pain is. Okay, that's his GCS. And then so here it is: open eyes to verbal stimulation. Confused, localizes pain. E3 pala is when you when he opens eyes to name call, when you talk to him pala, not tap him. Okay, so opens eyes to verbal stimulation, confused, localizes pain. Now when you when you examine his injury, it's you have a 4x4 centimeter contusion on the left frontal area, so it's here. Okay, 4x4. So, I just wonder if this is what's being used on wrestlers during this. I'm not sure. They probably do it if they examine the wrestlers. They probably do. It's part of physical examination. He got bricked. Yes, got bricked. Alright, so considering the patient, what are you gonna do, chat? What do you do to a patient with a head trauma who has loss of consciousness for a while and then with a decreased sensorium? Instead of GCS 15, he's a GCS 12. and there's a apparent head injury. What do you do, chat? What is the... What are you guys gonna do? Considering that that's the only injury he has. Okay? That is the only injury you physically see. CT head and neck CT scan. Yeah. Okay. Neck. CT scan of the neck, that would depend. If the patient has complaints about neck pain, or if the patient comes in with a cervical neck collar, yeah, you can do a CT scan of the neck to rule out any cervical spine injuries. Okay. So yeah, you do a cranial CT scan. Okay. Cranial CT scan. Every time there is a head injury, especially if there is loss of consciousness. Okay. If there is loss of consciousness, or if there is vomiting. So loss of consciousness or vomiting. Then yes, you do a CT scan. And if there is a decrease in the GCS less than GCS 15, you do a cranial CT scan. Okay. Because you have to rule out any injury in the brain, or even a bone fracture, a fracture in the skull. Okay. So, amare, you do and then you have to observe for a decrease in sensorium. So here we go. These are the most common traumatic brain injuries I see. So if you have a positive CT scan, so meaning positive bleed. So there are two types of bleed. You have the subdural hematoma and the epidural hematoma. So subdural is within this lining over here. This lining, this white one, that is the dura, or the lining of the lining covering the brain, or the capsule after the skull. So subdural is a bleed within the dura, between the dura and the brain. An epidural hematoma is between the dura and the skull. Okay? So, if the CT scan is positive, there's a bleed, and depending on how much the bleeding is, they may need a surgery. Okay? A craniotomy. So, craniotomy is where you drill a hole on the skull and drain the blood. Okay, if there is a depressed skull fracture, let's say like this one, you have a skull fracture and the bone in it, alam mo yung paloob siya. Unlike here, you have a fracture but it's still in line. But over here, you have a depressed skull fracture. You can, the surgery is to elevate the fracture and align it again. Okay. So this is usually, this kind of surgery is done by neurosurgeons. The last time I have assisted a neurosurgeon, and this is like when I was on my 3rd year residency. So, yeah. If the CT scan is negative, all you gotta do is just observe. Because there are some times when there is an injury and the bleeding comes after. There's like delayed bleeding. It happens. Like, initial CT scan, there's no bleed. And then all of a sudden, the patient has a decrease in sensorium. There's suddenly from GCS, let's say patient O got hit in the head, but he lost consciousness, woke up, and is GCS 15. Or awake and coherent and conscious. And then you do a CT scan and it's normal. You have to observe, because if he goes from a GCS 15 to a GCS 12, you have to repeat the CT scan. So, and then usually when you repeat it, you will see that there is a bleed. And if the bleed is not addressed right away, it can be bad. Because if the bleeding, see the skull is like a jar, or the skull has to maintain a certain pressure. And because the skull only accommodates the brain and the fluid, the brain and the subarachnoid fluid, the fluids. Okay. So bleeding can sometimes be delayed. It depends, or it can be so small that it's not seen in the first CT scan, and then the second time around, that's when you see that, oh, there's bleeding, may bleeding pala. It's like a small bleed that is not seen, and then later on it bleeds. So the skull can only accommodate the brain and a certain amount of fluid inside. So what happens when you have bleeding in the skull, you're increasing the pressure inside. So what happens is napupush yung brain, diba? The brain gets squished. So if this bleed, kunwari itong bleed na to, subdural hematoma or epidural hematoma, you keep bleeding, and then what happens is the bleeding keeps going and going, and it just pushes the brain. You keep pushing the brain. And if this is not addressed, a herniation, an internal herniation of the brain can happen. So the skull has like alam mo yung the base of the skull has a foramen where the brain stem goes through. If the skull has so much pressure, the brain starts to herniate through that foramen in the base of the skull. I don't have a photo. Wait, let's see. Let's see. Internal brain herniation. Actually, this can also go for not just a brain trauma, but any ang tawag dito, any brain. Here we go. This is better. Any brain lesion or disease, or even it can also happen in stroke. Stroke has a bleed. What the heck? How do I? Oh, this is a PDF. How do I zoom in here? Wait, okay, I got a photo here. Here we go. This is a good one. Okay. Here we go. Here's one. Okay. Look at this. Here's a sample. So you can have, if there is a fracture or a hole here, you can have the brain herniating through the hole, okay, of the skull, or you can have, this is the one, the brain will herniate down here at the base of the skull. There's a foramen, and that is what kills the patient. Okay, so that's why the skull has to maintain the inside of the skull. They have to maintain a certain pressure, or else the brain's gonna be herniating everywhere, and that is bad. Okay, and once they start herniating, the patient will really deteriorate. Okay, so imagine your brain herniating out of here, herniating from all these holes. How about congenital? What do you mean, how about congenital? What do you mean by congenital? Kung pwede din mag-herniate. Congenital... Congenital what? Like congenital brain disease or something? Is that what you mean? Because if it's congenital, they present with congenital brain diseases present really early on, at like newborn. Those are the ones that are like, you know, those macrocephaly, anencephalies, you know, those things where they have either a very big brain or not a big brain, more like a very big skull. I've seen like a very big head, or they can have a very underdeveloped skull, but it's not herniation that kills them. It's the condition. When it comes to congenital brain stuff, I'm not really an expert at that one because that is very specialized. That's pediatric neurosurgery or pediatric neurology, and that is very subspecialized. So, hello, Jax. Paano yung mga malalaking bukol sa ulo, yung mala 90s? Okay. Alright, if you're gonna talk about, those are hematomas. Or contusions. If you have a lump on your head, because it's natural that once you get hit somewhere, if you get hit anywhere, not just the head, anywhere part of your body, it's going to bleed, right? It becomes a lump. Parang bukol. Because parang bukol siya, di ba? It's the same on the head. You can have a lump on your head. You can have a lump on your head, but no brain injury. So that means the bleeding is on it's just skin level. It doesn't reach the brain, and that's okay. You just treat it like the usual, like how you treat a lump, this cold compress and stuff like that. Okay. Let's see what's next up. So, ayun. Ayan, so if there's a decrease in sensorium, do an immediate repeat cranial CT scan and then prepare for surgery. Okay? Because if there is bleeding and it's getting bigger, you gotta do something about it. Okay, and I think that's my last slide. Okay, so yeah, that is my last slide. So, yeah, poor O and poor JTR. They, suffered quite a lot of injuries today. Conclusion, pinauwi na rin si O. Pinauwi si O, tapos nahuli yung supporter na nangahagis ng bricks dun sa rooftop. Mas madami kayo. Isang linggo lang, ang daming injuries agad. Actually, that was just one day. If you look at it, everything happened today, November 12. Sino yung naghagis? Ewan ko. Secret. It was that supporter was turned into the authorities. Lesson learned: never go outside to avoid injury. So yeah, that's major trauma. So major trauma is a lot trickier than minor trauma, because minor trauma is very easy to manage as long as there's no major internal organ injury. All you gotta do is just stop the bleeding and then suture it, right? But I only covered the most common major traumatic injuries that I've seen. So that's just head, abdomen, and chest. There are other major traumas like the ones in the limbs, but I didn't cover it because I don't usually see them. But when we talk about injuries in the limbs, so that would include vascular injuries like, let's say, to parang nahiwa yung malaking ugat dun sa arm. Parang ano. Let's say you got a vascular injury on the arm. That is an emergency surgery. Or like a amputation from getting hit by a truck, stuff like that. Which I've seen, by the way. Team bahay para safe. Si Minukalo siguro wala din. Si Minukalo pala. Si Minukalo. Most accidents happen at home. Wear armor. Doc, walang quiz. Alam mo, Popmaster, kanina ka pa. Si Popmaster gusto niyan may quiz. Kanina pa yan eh. Kanina pa yan si Popmaster. Gusto mo ng quiz? I think Popmaster wants a quiz. Tunay na supporter yung may issue. Malay mo, you never know. Okay, siguro yung, most likely the supporter that threw the brick was probably the supporter that is a multi-timer. So yes, the suspects are either Minokalo or Ventix. May loyalty points na ba sila JTR at O sa hospital natin? Ba't may loyalty points? Ano turning the hospital into parang, akala mo parang, shopping, parang SM lang yung SM. Sana lang po Paano po yung mga injuries daw sa New Year fireworks? Oh, that's a good question. Well, actually, we don't get that much in fireworks injuries anymore because of the law. But most of the fireworks injuries are either burns or like amputations. So burns we take care of, but amputations are dealt with by orthopedic surgeons. Justice for all. Shareholder na yung dalawa. Teka lang, hindi ko ma-process. Tunay na issue ba yan or example lang? Anong issue? Hindi. Si Noe naghahanap ng issue. Noe, ba't ka naghahanap ng issue? Noe, kasi late yata eh. Noe, you're late. Late si Noe. Sa kamahal ng paputok. Yeah, we rarely get those, but yeah, mostly orthopedic surgeons are handling those. Busy ako kanina, sorry na. It was just this example. Noe. Si Noe mag-quiz. Medical education Swedish mystery. Parang gusto niyo ng quiz eh. I feel like you guys want a quiz. Okay, fine. We'll give you a quiz. Fine, we'll give you a quiz. Since Fapmaster has been asking for quiz, Donothon quiz. Pag bumagsak sa quiz, magdo-donate kayo ng $100. Joke lang. Joke lang. Just kidding. Kala ko na TV yung supporter na yun. Hindi ito graded. Graded to. Okay? Pag bumagsak, magdo-donate ng $100 sa Donothon. $100. Pag pumasa, magdo-donate ng pag pumasa, magdo-donate ng 200. Okay? Joke lang. Just kidding. Okay. This is a different Exempted ako, wala akong PayPal. Pwedeng GCash. Okay, yung mga late minus, mga latecomers, kagaya ni Nue, minus 100 points. Okay. Anyway, sige, number 1. Okay. Number 1. Get mga supporters. Get 1/4 sheet of paper. Kopya. No cheating. Ang cheaters magdo-donate ng $500. Okay. Matik pa. Si Milo pati si Beth. Okay. Number 1, what is the surgical treatment for pneumothorax and hemothorax? Madali lang yan, ha? Kahit abbreviation, pwede na yan. Treatment for pneumothorax and hemothorax. Kunwari, yan, si JTR kanina. Just like JTR a while ago. Got stabbed. You can give me the abbreviation. Chest tube insertion, CTT. Pneumothorax na nga lang na-retain sa utak ko. Master. Doc, ang ganda mo. Itong si Noe, late ka na, minus 100 ka na. Hindi ko maalala yung term, yung tusok-tubo. Tusok-tubo. Okay, the answer is CTT. Ito naman. Chest tube insert. Pwede. Okay, fine. I'll do chest tube insertion is okay. The name of it, the answer is CTT or closed tube thoracostomy. Chest tube insertion is fine. Gripo. Gripo. What number 2? Ano kaya? Number 2. What is the fastest imaging an ER or a doctor or a surgeon can do for a patient that has an abdominal injury, a blunt abdominal injury? What imaging? So is it a CT scan? Or is it something else? For a abdominal injury, okay? Abdominal injury, hindi chest. Hindi chest injury, abdominal. Iba yung chest, iba yung chest, iba yung sa abdomen. X-ray, CT scan. Fast. Okay. Yeah, the answer is fast, okay? Fast. chest. I said abdomen. Fast or ultrasound? Ayan, sige. Fine, I'll give. Sige nga, ultrasound. Pwedeng ultrasound. Ultrasound. Next, number 3. Number 3. Let's make number 3 case naman. Case, okay? Case. So, listen carefully. Okay, teka, mamili ako ng... okay. Listen carefully to this case, okay? Tapos, and then the question. So, we have a patient comes into Supporter Medical Center Emergency Room. Kayo yung duty. Okay? Kayo yung duty. Tapos, dumating yung patient. Si MP. Okay? MP yung patient. Babae. MP female. Okay? Came in to the ER. Tapos ang sabi niya, kanina around 3 p.m. Mani Pacquiao. 3 p.m. Okay, she was crossing the street at 3 p.m. And then there was a car that and she got hit by the car. Okay, she got hit by a car at 3 p.m. And then she is complaining of difficulty breathing. Okay? Her vital signs, okay, blood pressure is siguro mga 100/80. Yan, 100/80. Heart rate, mga 99. Our respiratory rate is 25. Temperature is normal. Oxygen saturation, siguro mga 94. Okay? She got hit by a car. Vital signs, so heart rate is a little fast. Respiratory rate is a little fast. Oxygen is a little low. Okay? She is speaking to you in phrases. Medyo hirap huminga. Medyo lang. Medyo hirap huminga. Okay. No other injuries. So what imaging will you request? Manong Pokri. Ano ba yung witch na yan? Nababangga pa rin sa Nabangga! RR25, yes, RR25 is fast. Normal respiratory rate is 16 to 20. Anything higher than 20 is considered high, so yeah. Lit ng witch na bangga pa rin. Okay, let's see. X-ray. MRI. Ba't MRI sa ulo? Her complaint is the chest. Her only injury is on the chest. Okay, let's say the injury is just in the chest. I made it easier for you guys. What imaging? Chest X-ray. SUV yung nakabanda Fortuner. CT scan. Ang ganda talaga ni Doc, no? Yan lang nakikita kong imagery. Bolero talaga itong si Nue. Nue, bolero ka. Okay, yeah. Okay, the answer is, chest X-ray. Chest X-ray. Okay, that's the answer. Chest X-ray. Okay. Sa wakas may point na din. Okay. Number 4. Ano pa? Okay. Number 4. So, Okay. So, kunwari, si O. Si O, yung O kanina, yung case ni O kanina, di ba? Si O is admitted in Supporter Medical Center. He is a victim of that one supporter that threw a brick from the rooftop and got hit in the head right on the left frontal area or the left side of his head. On his CT scan, so O's CT scan, okay, O's CT scan showed a bleed. I think it's better if I draw it. Let's draw it. Okay. Ganito yung itsura ng CT scan niya. Kunwari ito yung skull. Kunwari ito yung CT scan niya. Okay? Yan yung CT scan niya. Tapos, wait, how do we draw the brain? Drawing ko muna yung brain. Ito na. Let's draw the brain. So, yan. Kunwari ito yung brain niya. Kunwari ito yung brain niya. Brain. Kunwari yan yung brain niya. Ang pangit ng brain. Kunwari, ito yung CT scan niya. Ito yung kita mo yung brain niya. Ha? Okay? And then, ito yung dura. Okay. Kunwari yan yung CT scan niya. When you looked at his CT scan, he has bleeding in the brain, okay? His bleed is here. Bleeding is here. Between the dura and the brain. So, ganyan. Bleed niya. What kind of hematoma is this? O, dalawang klase yan. I said that a while ago. Yan. Ganyan yung itsura ng ano niya. Ha? May crayon sa utak. Smooth brain. I don't know how to draw brain, okay? Subdural. Crayon sa utak. Wow! Alam nyo ah. Okay, yan. Subdural hematoma. Galing nyo ah. Subdural hematoma. At least nakikinig kayo. At least I know now you guys are listening. Nangopya. Wala. Parang kansit kanta na may ketchup. Okay, number 5. Or last question. Last question. Okay, last question. Yung sagot sa number 2, 'di ba? May sagot sa number 2, 'di ba? Fast? Anong ibig sabihin ng fast? What is the long name of fast? Anong ibig sabihin ng fast? Ano, ha? Yan natin kung maalala nyo. Mahaba yan. Pag nasagot nyo yan, plus 100 points. Bilis. Isip kayo. 100 points. Anong ibig sabihin ng fast ultrasound ko yun? Forever, always, you need to. Religious fasting. Bayad na lang po ng pera. Mabayad na lang po ang pera. Space arm speech time. Walang iya kayo. Fast acting supporter tuli. That sounds like a medication. Mamaya kayo. Walang nakasagot. No one knows. No one remembers. Okay. The answer is focused assessment with sonography for trauma. Sorry yun. Ayan! Focused assessment with sonography and trauma. Okay? That's what it means. Hayop kayo. Alright. Okay. O, pass your papers. Sino kaya bumagsak? Siyempre si Inoue, bagsak na yan. So, ano, utang ni Inoue, $200. Front news archetype na supporter tinuli. Alright. Pass your papers. Forever alone supporter. Dok, kinaya ng aso yung... Ba't may aso sa classroom? Alright! Okay, guys. I hope you guys... Ay, ba't nawala yung chat? Where's the chat? You're gone! The chat is gone! Ayun, ito pala. Okay. Every time I switch, nawawala yung chat. When I switch, the chat resets. Alright, guys. So, I hope you understood the topic for today. I hope you guys learned a lot. Mag-agree na kasi kayo mga parang ganda-ganda talaga dito para pumasa din kayo. Hindi ka naman pasado, Louie. Ano pinagsasabi mo? Hindi ka naman pasado, ah. Okay. Alright, so thank you guys for coming to my stream today. Next stream is tomorrow. Tomorrow night. Next stream is tomorrow night on Twitch. So, wait. Tomorrow is November 3rd. Let's see. I am going to stream. We're gonna fulfill one of the... Ito. This is the Donables. Where are the Donables? Alright. So, what did I not? Okay, we did the community games, we did solo repo, we did the Kanya Speak, the super spicy ramen, baka on another stream. What I'm planning to do tomorrow is, yung we'll do pure Tagalog. I am going to play a game, tapos pure Tagalog. I wanna get this one out of the way. Kasi I still haven't bought the ramen yet, so I have to buy it. So we'll do the ramen another time. Siguro on a chatting stream, I'll do the ramen. Tomorrow I'm gonna play a game. And then on Friday I was supposed to do Raid Chat's bathroom, but I haven't made the form yet. I'll probably do this next week. Before I disappear again. What's this? Oh no, I can't. Oh, thank you for the super... Oh, kakagising ko lang, sorry. Podok, it's okay! Thank you for the super chat, Kyosha! 200 minus 200 si Kyosha. Are you gonna eat several spices? Just one? I will see if I can do that one next week. Cause, teka, schedule ko. Oh, shoot. Wait. I only have... Actually, I just realized the only day I can stream next week is 17. I won't be able to stream the rest of the week next week, actually. So, yeah. So, next week, I'm actually gonna be gone. Yeah, pag-isipan ko po na to. Yeah, I'm going to have to do this. I'll have to really schedule these. I'll have to schedule these. Yeah, next week I won't be. I'm only gonna be able to stream one day next week. So because I have to do something for the rest of the week next week. So no streams, only Monday, and then that's it. Wait. No, wait, I think I can stream on Tuesday, but in the afternoon. Yeah, I think that's it. Tuesday is the last day of my stream. And then, that's it. And then, my next stream after that will be on the last week of November. Versus Gun. No, it's not. No, it's not. It's not over. It's not gala. No, it's something else. Conference. No, it's not either. Basta I have a personal business to attend to. There's also another week when I can't stream also, which is on December, second week of December. That one is because there's a surgery conference, surgery convention for like 5 days. So, yeah. But the Donathon will still keep going. I'm just gonna post stuff. Hopefully I can still get some donations while I'm gone. So yeah. Tingnan ko na lang kung anong isa-stream ko bukas. Because I'm just planning this as we go. I'm just planning this as we go. So there's actually still a lot. Look at this. I still have to do activate Ikim and ShioriPon. You know what? I can probably do this at the same time with another stream. I can do some of this at the same time with another stream. Okay, we'll see. For the bathroom thing, it's probably baka next week. Because I still haven't I still haven't opened the Google form for this. Cause this week, so I think if I post it today, it's gonna be a little too late for me to prepare for Friday. Wait. Yeah, the bathroom photos for Friday. Because I know you guys still need to take pictures of your banyo. I'll probably stream that on Monday, the bathroom one. Because Sunday is actually... If you notice my stream, so, my stream schedule, Sunday stream is early, 11 a.m. Philippine time. Yeah, because it's a collab. So, yeah, that's why. That's why. Yeah. And I'm not sure if I will stream again Sunday night. Depends. Yeah. Kasi I think I am going to... yeah, I'm not sure. Basta, bahala na. Bahala na. Basta yun yung schedule. Alright, so Otsupon guys, thank you for coming to my stream. I hope you guys learned a lot. Wait, let's see. Can I redirect to someone? I don't know if I can redirect to someone. I really don't like this thing. I don't like the raid thing in YouTube. Ang daming pipindutin, nakakainis. when I'm trying to raid someone on YouTube, naiinis lang ako. Kasi ang daming dadaanan. Oh, there's no one. Wala. Okay, there's nobody. Wala. Yeah, there's none. Okay. We're just gonna end stream. Alright, Otsupon. Thank you. I'll see you guys tomorrow night on Twitch. Bye-bye.